or pre-exposure prophylaxis, it's a drug or a combination of drugs that HIV negative people can take to prevent or to lower their risk of getting HIV. So PrEP should not be confused with PEP. PEP is post-exposure prophylaxis, and it's in the name. So this is something that it's a drug that you will take after you've been exposed to HIV, and usually you'll take it within 72 hours of having been exposed to HIV. So typically you find that if you are a rape victim, for instance, they'll tell you that you need to go to the hospital and get checked and all of that, and usually that's when PEP will be administered in that particular instance. Whereas PrEP is pre-exposure. So this is prior to being exposed to HIVs, before you get exposed to HIV. So these two drugs should not be confused, as they serve different purposes and they don't do the same thing. So there are different options of PrEP that are currently available. The first option is the once daily oral tablet, and this is the well-reported PrEP that I think a lot of people know about. And it's a tablet that essentially you will be taking once every single day, as long as you are at risk of having HIV. And yeah, I think the downside of the once daily oral tablet is that it's not discreet, and it is something that you obviously have to keep remembering to take every single day so that it can be effective and you can be protected from getting HIV. So I think those are like maybe the downsides of using this particular method, but it's been around for quite a while and it's well documented, and the side effects are very little to none. So I think a lot of people usually tend to take it, but also there's an issue where a lot of people actually don't adhere to it. They don't stay on the drug. Like they'll start taking it and then somewhere halfway they don't take it regularly, or a person forgets to take it, and that usually will present a lot of issues or a lot of problems for you in the long run if you take it like that. So if you are someone who knows that you can't take the oral tablet every day as it should be taken, then there are other options for you. So the first option is the long-acting injection. This is called cabotegravir. It's an injection that essentially you will be taking every 2 months. So with this injection, what ends up happening is that it's intramuscular, right? So for the first 2 months, you'll take a single dose. You have a single dose each month for the first 2 months. And then this is just to determine if you can tolerate it and it's not causing any adverse health outcomes in your body. So it's just to test it out for the first 2 months. And then if actually your body can tolerate it, then you'll then be going to a healthcare provider, and every 2 months you will be getting injected with this injectable. You can't take it on your own. You actually have to go in and have it be administered to you. That is a thing that you need to keep in mind. And the unfortunate part about the injection is that it's not widely available yet. So you can only get it through pilot studies because it's still being rolled out. It's still early, so they're trying to sort of like straighten things out and make sure that it's ready and it's safe enough to be rolled out to the entire population. I know, for instance, in the Western Cape, there's up to 900 people that can actually take this injection currently. So yeah, it's not yet available in government clinics, for instance. So you can only get it if you are involved in a pilot study. So the next option of PrEP was designed with women in mind. So this is the Depivirine vaginal ring. It's quite similar to the contraceptive vaginal ring, but in this case, it's not a contraceptive, it's PrEP, right? It's a drug called Depivirine. So what you need to do with the vaginal ring is that you insert it in your vagina, and you can insert it yourself, and essentially it will be releasing this Depivirine drug, and you have to keep it in there for up to 28 days. So for 28 days at a time, you will be protected with this vaginal ring, and at the end of every 28 days, you have to change it and get a new one. Obviously, this was designed for women because you need to have a vagina to take it. So yeah, it was designed with women in mind, and it's also because we know that women are disproportionately impacted by HIV. I mean, for every one boy or young man, there are 3 women or young women or adolescent girls actually that are HIV positive. In sub-Saharan Africa, for instance, a young woman or an adolescent girl is infected with HIV every 3 minutes. So hence they came up with this vaginal ring so that they can be for women and they can give women options. And what I like about the vaginal ring is that it's discreet. It's something that your partner won't really have to know about. Especially currently, we live in there's a stigma around the use of PrEP, where if you're taking PrEP, people tend to assume that you are sexually promiscuous, right? Like you're sleeping around, you have multiple partners. So taking the vaginal ring and the injection, I feel it's a way for you to be discreet so that no one knows that you're taking this except you and your healthcare provider. So the good thing about this vaginal ring is that in South Africa, where we have high rates of sexual violence, it's quite ideal. We still have economic disparities. We have unequal power dynamics in sexual relationships whereby women are not able to negotiate for safer sex, or they're not able to determine when or with whom they have sex with. And obviously such issues, they end up driving this intimate partner violence, and then all in all, it increases the risk of a woman acquiring HIV, right? So if you have something like the vaginal ring or even the injection, that helps, because then a woman can take these things safely without an abusive partner, for instance, knowing that they are taking these methods to protect themselves. So that's why I kind of like the injection and the vaginal ring. I think they're such good options and alternatives for the oral tablet. One of the important things you need to keep in mind when it comes to PrEP is that it should be taken by HIV negative people that are ideally at risk of getting HIV. And I place emphasis on HIV negative because before you get on PrEP, you actually need to show that you are HIV negative. So typically what ends up happening is that they actually test you, and you need to be HIV negative before you can go on this medication, and you need to stay HIV negative while you are on PrEP, or else it can lead to a lot of issues for you in the long run. So this brings me to my next point of the people that should be considered for PrEP, or essentially how do you know that you are someone that should be taking PrEP? One, ideally you should be at risk of getting HIV. And the people that are typically at risk of getting HIV, it's, for instance, if you are a serodiscordant couple. So serodiscordant couples are couples whereby the one partner is HIV positive and the other partner is HIV negative. So in this situation, usually the partner that's HIV positive is not virally suppressed, or they're not taking ARVs, then you as the HIV negative person, you are an ideal candidate for PrEP so that you can protect yourself from getting this particular virus. Other people that can be taking PrEP are people that don't always practice safe sex. So if you know that you're not always using a condom, then you also are an ideal candidate for PrEP. If you know that you have multiple sexual partners, you also should be on PrEP. And if maybe you are someone that is engaging in sexual activity with someone who is a member of a high HIV prevalence population. So a high HIV prevalence population is, for instance, men who have sex with men. So they are considered to be a high HIV prevalence population. So if you know you're engaging in sexual activity with MSMs, or men who have sex with men, then you are also an ideal candidate for PrEP. Other high HIV prevalence populations include adolescent girls and young women, particularly from the age of 16 and 24. So those are also considered to be like a high prevalence population. And sex workers. So if you know you're engaging in sexual activity with sex workers as well, you should consider being on PrEP. Or maybe if your partner uses intravenous drugs and they share needles with other people, then you're also an ideal candidate for PrEP as well. So yeah, you should be considering this if you fit the profile of what I've mentioned. And another one that I think people don't really know about is that if you were recently diagnosed with an STI, particularly in the last 6 months, you are also an ideal candidate for PrEP, because typically with STIs, they make you more prone to getting other STIs like HIV. So if you know that you were recently diagnosed with chlamydia, gonorrhea, herpes, or any other type of STI, then it is something that you need to consider if you know that you might be at risk of getting HIV. But another important one is that you could also ask for PrEP even if you don't really fit that profile. I mean, there are people, for instance, that are in marriages and maybe you're suspecting that your partner has multiple sexual partners. Then PrEP is also for you. Ignore the stigma and do what you need to do for yourself, for your health. There are options that are more discreet. The injection is there, the vaginal ring is there. So these are options you could consider taking if maybe you don't want to have to be taking the oral tablet. So yeah, it's not always the obvious people that need these kinds of things, but if you think, yeah, you might be at risk, I think it's something you really should be considering and looking into. It's a worthwhile option. So how long before PrEP is active? Essentially, how soon will PrEP protect you? So they say that you need to be taking it for at least 7 days for it to reach protective levels for you to be able to have unprotected sex safely, or rather without being at risk of getting HIV. So you need to be taking it for at least 7 days. And then after that, you kind of sorted, then it should have reached its protective levels for you to go on and do what you gotta do. Do what you gotta do. Like any other drug, PrEP has side effects, and some of the side effects are like quite easy and not too intense. So for instance, the side effects of the tablet include nausea, headaches, weight loss, and apparently those usually go away on their own. In rare instances, there's a decline in kidney function. They find that your blood creatinine levels, so creatinine will indicate if your kidneys are kind of not functioning as they should. So they find that in people that are using PrEP, sometimes their creatinine levels are a little low. But yeah, options, you need to choose what's better for you. Another side effect of using the tablet is that sometimes there's like a slight loss in bone density, but apparently doesn't worsen over time. So again, you need to weigh your options. HIV, loss of bone density. HIV, weight loss. You kind of need to weigh your options when it comes to these things. With the vaginal ring, some of the common side effects include UTIs. So these are urinary tract infections. Sometimes you get vaginal discharge. Other times they say that you might get pelvic pain, or even get some, like it could get a bit itchy down there in the vagina itself, or like in the vulva. So those are some of the side effects for the vaginal ring in particular. And then the side effects for the injection will include, if you are maybe allergic, then you could have skin rash, you could have headaches, maybe a bit of tiredness here and there, diarrhea, loss of appetite, and sometimes mood changes. So yeah, when it comes to these things, for me with medication, vaccines, and all these health interventions, I'm always weighing my options, like what's more important at that particular time point. So you kind of just don't base it off of one thing, like which is worse, and then decide from that point onwards. While you are on PrEP, there are certain things that you're expected to do. For one, you are expected to get tested for HIV regularly. So I think in South Africa, we currently test every 3 months to make sure that you're HIV negative. And this is to avoid a person getting HIV while they're on PrEP. Because what happens is that if you get HIV while you're taking PrEP, this could lead you in having a virus, an HIV virus that is resistant to ARVs. And so what this means is that you won't get treated for your HIV. So that's why, one, you need to be HIV negative to go on PrEP, and two, you need to stay HIV negative while you are on PrEP. So you need to actually keep getting checked so that you're not HIV positive while you're taking PrEP, because there's a different treatment for that, for being HIV positive, and it's not PrEP. Another thing you need to keep in mind while you are taking PrEP is that you need to take it as prescribed. So if you have to go in and see a healthcare provider that will inject you with the injection, you need to do that every 2 months as they've stated, or as they would have recommended. And if you don't want to get pregnant, PrEP will not protect you from that. You need to use contraceptives for that. And PrEP will not protect you from other STIs. You will need to use condoms if you're worried about getting other STIs, essentially. The good thing about it is you don't have to take it forever. It's not like ARVs where it's recommended that you have to take it forever. You don't have to take it forever. As soon as you feel like you're no longer at risk of getting HIV, you can stop. You can actually just stop, and there's no need for you to be on heavy medication when you don't need to be. But once you are on it, take it as prescribed so that it is effective and it doesn't cause issues for you in the long run. In South Africa, PrEP, I know the oral tablet, you can get it from government clinics. And if your government clinic or the one that's nearest to you, clinics, I think like government hospitals as well, I think also in the private sector, you can get the oral tablet. You should be able to. And so like if you want to get it from a government clinic and the one that's near you doesn't have it, you can just ask them which one would have it, and they should be able to direct you to the correct clinic that will have PrEP for you to get it from. With the injection, as mentioned before, it's only available through pilot studies. You can't get it from the private sector or the public sector. It's only through pilot studies. You need to be involved in the pilot studies. And with the vaginal ring, apparently it's only available through the private sector. and it's between 300 and 400 rands. So what you need to do is you can call the AIDS helpline for free of charge, and they can tell you exactly where you could get it and how to go about getting it. So yeah, you know, it's quite accessible, and again, you've got options. You can choose my kettle. So yeah, all in all, I think the choice for taking PrEP is a personal one. I think it's a personal one, but what I like about it is that it offers you options, right? And since we currently don't have a cure for HIV, then there's options of saying you can actually prevent this particular illness or disease from happening to you altogether. So I like the options that it gives you, that you can choose, and you can choose whichever option works best for you. So yeah, I think it's a personal choice, but I think if you are someone that's at high risk, if you're a sex worker, for instance, or maybe you suspect that your partner might have multiple sexual partners, I honestly think it's something you really should get onto, because, hi guys, I'd be so pissed if someone made me HIV positive. Like, I'd be so pissed, man. And you know, it's I'm not saying that like it gives people the right to go and do whatever they want. It doesn't make it okay to do that, but it is an option that's available and that one should consider taking, I think, and it's a viable option, you know. So I think it's something you should take if you need to take it. On the other end, there are more options that are coming up. So there are other PrEP products that are in the pipeline that could further expand your options. Merck, for instance, that pharmaceutical company, is developing a monthly pill. So, you know, you can just like take one pill every month and then you're sorted. And then VWIV Healthcare, it's a multinational British pharmaceutical company. They're looking into developing a pill that's only going to be taken every 4 months. And then Gilead Sciences is looking into developing a pill that you can take every 6 months. So yeah, so like those are some exciting things, I guess. More options, you know, for people that need the options, which is all of us. It's always good to have options when it comes to healthcare, I find. So yeah, as usual, guys, thank you for getting to the end of my video. And like, what are some things that could make you not want to go on PrEP? Like, let me know in the comment section. Or like, what do you think you're afraid of when it comes to PrEP? Are you worried that maybe people might think you're sexually promiscuous? Are you worried about the stigma? Like, what are your thoughts on PrEP? Is there something that you think the Department of Health could do differently? Is there something that you think could be done differently around the issues when it comes to HIV and AIDS? And yeah, like, what are they? Let me know in the comments. As usual, my videos are here for educational purposes and not to give you medical advice. If you need medical advice, please speak to a registered healthcare professional that can give you advice that's tailored to your needs and your illness and whatever it is that you need. I will see you on my next video. Bye.